students, today we will learn about the bladder and urethra. The bladder is a muscular cystic organ. Generally, the bladder of a normal adult has a capacity of 350 milliliters, 500 milliliters. When it exceeds 500 milliliters, the maximum capacity of the bladder is 800 milliliters. The bladder capacity of a newborn is about 1/10 that of an adult. The capacity increases due to low bladder muscle tension. Anterior to the bladder is the pubic symphysis. The space between the bladder and the pubic symphysis is called the preaxial space or retropubic space in males. Within this space, there are the puboprostatic ligaments. In females, there are the pubovesical ligaments. Furthermore, within this space, there is abundant connective tissue and the venous plexus posterior to the bladder in males. It is adjacent to the seminal vesicles, ampullae of the ductus deferens and the rectum posterior to the bladder in females. It is adjacent to the uterus and vagina. The area between the ampullae of the ductus deferens on both sides in males is called the trigone of the ampullae. It connects to the rectal ampulla via connective tissue called the rectophysical fascia. Next, let's look at the shape of the bladder. The empty bladder is pyramidal in shape. It is divided into 4 parts: the apex, body, base, and neck. The apex of the bladder points anterosuperiorly form pier. A fold extends along the anterior abdominal wall to the umbilicus, which is the median umbilical ligament. The posterior surface of the bladder faces posteriorly. It is triangular in shape, forming the base of the bladder. The part between the apex and the base is the body of the bladder. The lowest part of the bladder is called the neck of the bladder. It connects to the base of the prostate in males and to the pelvic diaphragm in females when empty. The bladder lies entirely within the pelvic cavity. When full, the peritoneal reflection line of the bladder can move superior to the pubic symphysis. At this time, performing a suprapubic puncture above the pubic symphysis does not involve the peritoneum or contaminate the peritoneal cavity. The bladder position in newborns is higher than in adults. The level of the urethra is at the level of the superior border of the pubic symphysis. The bladder position in elderly people is lower. The puboprostatic ligaments in males or pubovesical ligaments in females, as well as structures like the median umbilical fold and medial umbilical folds, help fix the bladder in the pelvic cavity. Underdevelopment of these structures is an important cause of bladder prolapse and female urinary incontinence. Next, let's look at the trigone of the bladder. The inner surface of the bladder is lined with mucosa. When the bladder wall contracts, the mucosa gathers into folds, called bladder folds. However, on the inner surface of the base of the bladder, there is a triangular area located between the left and right urethral orifices and the internal urethral orifice. Here, the bladder mucosa is tightly attached to the muscle layer, lacking a submucosal layer. Regardless of whether the bladder is distended or contracted, it always remains smooth. This is called the trigone of the bladder. The fold between the two urethral orifices is called the intraureteric fold. As seen during cystoscopy, it appears as a pale band and is a clinical landmark for locating the urethral orifices on the trigone of the bladder, posterior to the internal urethral orifice in males, pushed by the median lobe of the prostate. A longitudinal ridge-like elevation is formed, called the uvula of the bladder. The trigone of the bladder is a common site for tumors, tuberculosis, and inflammation. Special attention should be paid during cystoscopy. The male urethra originates from the internal urethral orifice of the bladder. It terminates at the external urethral orifice. It is 16 to 22 centimeters long. It serves both urinary and ejaculatory functions. I parts. The entire male urethra is divided into 3 parts. 1. The prostatic part. This is the part that runs through the prostate. It contains the openings of the prostatic utricle and the ejaculatory ducts. 2. The membranous part. This is the part that penetrates the urogenital diaphragm. It is surrounded by the urethral sphincter. 3. The spongy part, or cavernous part. This is the part that runs through the corpus spongiosum penis. 2. 3 constrictions. The first constriction is located at the internal urethral orifice. The second constriction is located in the membranous part of the urethra. The third constriction is located at the external urethral orifice. It is the narrowest part. 3. 2 curves. 1. The subpubic curvature, which is concave upward, is fixed. 2. Asterisk note, likely refers to prepubic curvature. 2. The prepubic curvature, asterisk interpreted based on context, which is concave downward, is not fixed. During clinical catheterization, by lifting the penis upward to form a 60-degree angle with the abdominal wall, the prepubic curvature is eliminated. The female urethra is about 3 to 5 centimeters long. Its diameter is about 0.6 centimeters. It is shorter than the male urethra, wider and straighter. The internal urethral orifice is approximately at the level of the center or upper part of the posterior surface of the pubic symphysis. It is lower in females than in males. It runs anteroinferiorly, piercing the urogenital diaphragm, and opens at the external urethral orifice in the vestibule of the vagina. Around the internal urethral orifice, it is surrounded by the internal urethral sphincter, where it passes through the urogenital diaphragm. It is surrounded by the external urethral sphincter, which also acts as the urethrovaginal sphincter in females. The external urethral orifice is located anterior to the vaginal orifice. It is about 2–2.5 centimeters posterior to the clitoris. It is surrounded by the urethrovaginal sphincter, part of external urethral sphincter. There are parothral glands, Skene's glands. Near the lower end of the urethra, there are ducts open around the urethra if infected, and the infection can spread to the urethral glands, causing urinary obstruction